Welcome to the National Center of Pathology. We are a branch of Vilnius University Hospital Santaros Klinikos. We are the biggest tissue pathology diagnostic laboratory in Lithuania. We perform some close to 1/3 of tissue pathology testing. Once we have any doubts what we need to do in terms of technology, innovation, or if you need to transform something in your workflow, we always think, what is the patient value? So, although we are not seen by the patients too much, but we see the patients from inside, but also it's in our value system. We have some 20 pathologists in our center and covering most of the specialized areas in different degree. I'm a nephropathologist, so we perform kidney biopsies for many years, for decades already, for all Lithuanian nephrology units, also Latvia, and also receive biopsies from Kyrgyzstan. We perform intraoperative diagnosis for surgical rooms here on the campus for both National Center and also the University Hospital. So we receive the sample, we have to report in 20 minutes or less than 20 minutes. So that includes, looking at the sample, cutting with the cryotome, staining, and then pathologist looking at this. So we can imagine how intense this. And I think that's critical because the surgery team is waiting for our answer. Is it tumor, non-tumor? I think it's very important. We have upgraded our systems here. I hear that our technicians and staff are quite happy with this current setup. I think it's very important. We have long-standing, I would say, culture of perfectionism from the sample admission to the every step in the laboratory, going to the pathologist. See, we have quite renovated biobanking service. We have grossing rooms, everything connected in a good workflow. You don't want to mix up patients and the samples, so that's why it's very important to have the technologies which actually follow the patient throughout the quite complicated workflow that you have in pathology. Also, we're on the road of digital transformation for many years. We started in 2012. We have several scanners and use digital microscopy both for primary diagnosis but also for consultant, for computational research. We seek to go for automation, and you combine digital automation and lean culture. You get the mixture which enables you to serve the patient in the best possible way, what we understand as our mission. Pathology testing is commonly a critical step in diagnosis. All kinds of diseases can be diagnosed, and there are many opportunities to make a mistake here because human beings, you have overload, you have to manage different specimens. For that, it's very important that every specimen is registered in our information system just from very beginning, and then through every transformation in the steps. We have our in-house laboratory information system, but it also needs to be integrated with the equipment which we use to process the sample. So now it's becoming a must in pathology. So I think that's where you need to have good equipment, good integrations, good team, and quality assurance on the way. I think that's a major task for us, to develop and maintain this traceability throughout the process. We have paperless technique, but actually don't use paper from the beginning to the pathologist. I think that's a good indicator of the maturity of your information systems and the equipment. We receive samples from different cities, different customers. Anytime during the working day, once you receive a sample in the evening, you should process it the same way as you would receive in the morning. So that's important to have consistency of your tissue processing regimes. In every step you have its own source of variation. So that's a real challenge where you need to put effort to have the standard and then to keep to the standard. So, different from other laboratories, clinical laboratories, where they have high degree of automation. Pathology is still very dependent on sending up right processes and connecting people and machine. the quality of the slides is critical for pathologists to see the disease and diagnosis. And I would say we're very happy. We have very perfect slides, a very good laboratory. The better the slides, the better the pathologist can see. So I've seen slides from many laboratories worldwide. I think we are on top 10. Every field of medicine is progressing very fast in every area. So is the pathology. Because in pathology we serve actually all disciplines in medicine. Complexity of our work is expanding disproportionately, I would say, to what we can achieve. And it's very important in this context to have good automation, good efficient laboratories, but also add benefits which you can achieve from digital pathology. Since we have digital microscopy, now we can apply artificial intelligence tools. It's not to replace pathologists or anyone in the lab, but it's like another tool in pathologists' hands, like immunohistochemistry arrived 40 years ago. In some cases, it helps us to do our work faster, more efficiently. In other occasions, and I think it's even more important, is to have novel information that we cannot extract as human beings with our eyes, and we cannot understand or even measure those features. I think the future is consolidation, specialization, and of course technology advance. As medicine is becoming more and more complex, so the pathology becomes more and more specialized. I think it's important to have a critical mass of pathologists in the institution so they can help each other, consult. As a pathologist, you are also a physician, so you have to integrate the final outputs of whatever is it simple microscopy or it's AI, artificial intelligence. You understand what is the patient, what is his age, talk to his physician to get to the best personalized diagnosis.